Yeah, thanks everybody for joining us this afternoon, or actually this morning. So used to doing these in the afternoon. I know it's been a while since we've done a webinar, but this one is actually very important, especially for our healthcare clients. And it's regarding the new HIPAA that will be coming in 2027, if not before then. And I'll go ahead and pass it over to Henry to get started.
All right. Thank you, Stephanie. And thank you all so much for joining us on a Wednesday morning. Thank you very much for joining us. And we know you've got a lot of things going on and that you've got a lot of pressures facing you. And so we are excited about bringing this subject to you because I think this is really relevant. There's a lot of things that have happened just recently with the HIPAA law. And so we're going to get rolling and kind of walk through this. So the title of our presentation that we kind of shared out with you is the new HIPAA, how to prepare your clinic now to pass the new OCR audits and avoid cyber attacks. And I really wanted to put a little spin on that. I don't want you to pass your audit and just kind of eke it out. I want you to crush it. So we're gonna dial this up a little bit. I want to show you how to do that. We've got some demonstrable evidence that we've got a lot of clients that have gone through those sort of scenarios and done extremely well. And I want to show you how to do that in light of a lot of the changes that have come around just in the last few years. So today, what we're going to cover is four things. I'm going to walk through this. First is what you really care about. I hope I penned this right. We've talked to a lot of our medical clients over 26 something, 27 years, and I think we kind of have a feel for some of those things. So I'll try to put the whole rest of the presentation in terms of things that are important to you on a day-to-day operational basis. Number two, what's the OCR proposed to change and when are they going to happen? What has already changed will be kind of our third subject. A lot of that slipped by a lot of people's radars, and we'll wrap up with the top 6 things to do right this second. So without further ado, let's just jump into it and see if we can stay on target here. All right, so let's talk just your average clinic, average practice, whether you're a hospital, a small clinic, a large clinic. There's kind of 3 sections of your business: operations, finance, and staff that I'm going to highlight here. And these are the things that our clients have told us over the years that really hurt when they happen from an operations perspective, maybe when staff can't work because the stuff is down. And maybe you see some familiar scenarios in here, or some things that are maybe a little painful to recollect. But ransomware shutting things down, shutting down scheduling, maybe patient appointments are getting canceled because you've got to move things around because the systems are down. Insurance claims can't be processed. Providers can't access those records and even get into the EMR. When those things happen in the operations department of a clinic, we know that hurts. So we're going to kind of keep that in the back of our mind throughout the rest of this presentation. How can we use the changes that are happening in the HIPAA law, the changes that have happened, and maybe stuff outside of HIPAA even to focus our efforts on reducing these scenarios? Let's look at staffing issues. Some of the things that we've seen happen a ton, especially ramped up since COVID, is turnover and training those people when they come around. New people coming in and out a lot. Employees sharing passwords. We've all had the issues of having to get rid of common passwords and passwords underneath the keyboards, and now employees are sharing the passwords and for either logging into the computer or logging into different systems, and it's just a real pain. Remote workers, that's a thing now for a lot of people, and a lot of organizations say, no, we're just not doing it. And a lot of organizations have just 1 or 2 or some key people who are working, or maybe just the providers are accessing some records overnight or at home. There's generally some degree of a mix there. And remote device management, like when we have remote workers or we have laptops out in the field or those cell phones that can get into Office 365, how are we managing that? How are we inventorying it? Those are real problems for most clinics. So kind of wrapping the idea of looking at what's hurting, let's talk finance. This is ultimately, follow the dollars and we'll figure out what's going on in a place. The top financial things that we see our clients really bringing to us is like costly breaches. Like the issue of a HIPAA fine is not one anybody wants to consider. It can be terrifying. Lost productivity is a big deal. You look at your average check-in, check-out person or front desk, and maybe what they make, and you look at how many of those you have. And if we're down for 2-3 hours, or God forbid, if we're down for 2-3 days, what's the cost of that? Then we look at how many canceled appointments do we have, and what's the decrease in billing. Cyber insurance requirements and the costs around those are going through the roof, and that is a really painful one. And one issue I didn't put on the screen here that none of the CFOs that we work with and most of them get pretty upset about is just surprise costs. Period. Like I wasn't planning on a new server this year. It's not in the budget, or a new firewall, or a whole new multi-factor authentication system, or whatever. Just any surprise is really painful. So what can we do to reduce those issues? And maybe let's put it in a different spin. What are some of the signs we can look for to avoid those problems? What are some of the things that are coming down the pipe that, if we're paying attention right now, in the fall, doesn't feel like fall, it's probably still heavy summer, but right now in August of 2026, what are some of the things that we can look for to know what's coming down the road? Well, in that grand scheme of things, we all kind of get the idea of maybe a leading indicator, or a thing that if we look at that gauge on the car, we know if that goes in the wrong direction in the future, I'm going to have a problem. It's kind of a that sign that risk ahead, or detour, or those clear indicators. Here in Louisiana, we also have these crazy signs every now and then, and most of them don't look this new, but if you've ever seen one of these, alligators are common in this area, or like "don't feed the alligators" signs, you probably live in Louisiana or maybe Florida, but we've seen those too. Another sign that we know to look out for in Louisiana is when we see this guy on our TV. You see Jim Cantore on your television, it's hurricane season, and there's probably one brewing in the Gulf. All joking aside, there are some clear signs that we can look for in the world of HIPAA, in the world of cybersecurity, to kind of be able to gauge what we should do in the near future. Let's dig in just a tiny bit here. One of the key signs I want you to really pay attention to is what the OCR has been doing. It's a really good indicator of where they're at. And without reading through this, and by the way, at the end of this presentation, if you want a copy of the slides, I think we're going to record this whole thing and you'll be able to get a copy of it. But you don't have to read it word for word here, but in the last 12 months, the OCR has fined like $2 million plus in settlements against 6 covered entities where failure to conduct an accurate and thorough HIPAA risk analysis was expressly cited. And it's really important that we understand the terms accurate and thorough. We're going to put a pin in that, and we'll walk through like what do they mean, accurate and thorough. Let's put some definition to those terms. You can Google these guys. These were just in the last few months, and they're ramping this up. We'll talk a little bit more about that as we go. Let's go further back and kind of get a feel for the land of HIPAA. In 1996, this thing was enacted, right? That's a long time ago. And we all kind of think, okay, we know HIPAA, not much has changed with it. Nothing really has gone on in that world. In 2009, the high-tech law happened, and it kind of dialed up some of the technical protections and really put some penalties behind a lot of the HIPAA infractions. 2013, we got this beauty. I love this document. It's the administrative simplification. I think it's like 120 something pages. That's their version of simplification. But it really helped kind of codify and make it, for lack of better terms, a simpler read to understand what a covered entities organization, covered entities obligations rather to meet the HIPAA laws were. And then in 2024, so like 11 years later after the administrative simplification, here's what happened that's pretty relevant that a lot of people missed. It's this NPRM, Notice of Proposed Rulemaking, that happened it was put out by the OCR. It was kind of quiet, and it's a proposed rulemaking. We're going to talk a lot about that in just a second. But also in 2024, the OCR kicked off what they call their Risk Analysis Initiative. So these are some key things that have changed, and we'll go back to this timeline a little bit more, a few more times throughout this talk to kind of dig in. But let's look at that Risk Analysis Initiative next. But first, let's dig into the NPRM. To understand, and I apologize, this is going to get a little technical. We'll go fast, and you'll get a copy of the recording and all the detail that you want afterwards. I'll be glad to share with you. But to understand what the Notice of Proposed Rulemaking is and why it's significant, we got to get a little feel for what the HIPAA law is. Most of y'all, I'm looking at the list of people on this. I don't know all of y'all, but I know a few of you, and you guys know this probably better than I do. But the HIPAA rule is made up of three things: administrative safeguards, policies and procedures, and that kind of stuff; physical safeguards like locking your rooms, securing your workstations, and technical safeguards like encrypting email and access control and firewalls and those kind of things. So there's kind of three areas of things that the HIPAA law, as it currently is codified, addresses. Simple enough. The fun part is that there's a lot of things in there that say this particular safeguard is required, no matter the size of the organization or complexity or what specific line of business you're in. There's a lot of things that are addressable, like it's up to you to find a reasonable and appropriate, they lean a lot on those two words, reasonable, appropriate implementation of this based on the size of your organization, your budget, your system complexity, those sort of things. In December of 2024, the Notice of Proposed Rulemaking came out, and at that time, they were saying that it was going to come into effect in May of 2026, with compliance mandated like 6 months after that. So early or end of year 2027, 2026, or maybe early 2027. Obviously, the time has kind of come and gone, and our government has kind of delayed getting this off the ground. But it's still incredibly important to understand it, because it is what will affect dramatically whatever's going to happen next with HIPAA. So let's dig in just a tiny bit. What does the Notice of Proposed Rulemaking explicitly say they're going to do? And by the way, we're on like a multiple revision stance right now. There's been a long time for covered entities and lawmakers to submit feedback, and it's gone through a few revisions. But in that first category, in the addressable issues, the administrative things like the policies and procedures, right? How you do stuff, maybe not technically or physically, but just kind of those policies. Almost every one of the ones that in the old version was addressable, like you can do this if you're big enough, or you can do this if if you're this kind of organization, but you don't have to do it if this or that or the other condition is true. All those addressable administrative safeguards are becoming required. For example, required risk assessments with very specific timeframes and update cycles, risk management program with annual updates and testing and very specific like checklists about how to do things. I won't go into all of it, but that's the highlights there is the administrative section. What they're trying to get past is for all of the addressables to be required. Next up, under physical safeguards, all of the addressables under the current draft of it, every one of them is required. So no more question about how you handle visitors or staff, and absolutely zero question on drive encryption, which is a unique one for a lot of our clients and a lot of companies that we talk with. Drive encryption is kind of a thing that we have, and we don't have a whole lot of great control over it. They're going to really dial that up a lot. And a significant point there is there's a definition here that's kind of tucked away in smaller text. But one of the things that they're going to do in this in the current version of it is that they're going to redefine which computers you have to do what with. Simple example, a lot of our clients tell us, okay, this computer, it really doesn't have access to these systems. They only maybe log in every once in a while, or maybe they only hit it this way, or they access only some pieces of the data. And the NPRM has reduced a lot of gray area there, and it says now that any device that handles or could compromise EPHI is going to be classified as what they call a relevant electronic information system, or relevant system for short. So anything that could handle or could compromise, and that could compromise is, if you're of a technical nature on this webinar, you know the drill. Like it doesn't take much to hop from one computer that doesn't usually access it, but it's on the same network or has access to that via VPN or some other system. If there's any way possible that a bad guy sitting at that computer could compromise EPHI, it's a relevant system now. And those relevant systems must meet specific technical and physical safeguards that they're defining here, all the rest of it. So the doctor's home computers, the remote access computers, the machines with very limited access, heck, even the computers that control cameras or elevator systems or phone systems, those are all going to have to be looked at much more carefully to say, if a bad guy was sitting at it, could they compromise EPHI? Next up, as we go walk through it, the technical safeguards in the NPRM, they're updating to more modern controls. And really, nobody likes being forced to do something, but I got to tell you, a lot of industries have moved past this years ago. And personally, I'm excited to see this as being more clarified for our covered entity clients, because it really is best practices, no matter your industry, just in the light of how the bad guys are acting and how the bad actors are getting into computers these days. So the more modern cybersecurity protections that we're going to be requiring is a lot more stringent control on encryption, again, to the relevant systems, which, i.e., for most covered entities, means everything. MFA is going to be required to identify users and to control and log who logged in where. In the past, it was a little vague, like you could use a couple other systems or technologies or processes to control your people. Now MFA is just the way. Audit controls and logging, SIM or similar is going to be required, and you're going to have to put in a process to make sure that it's reviewed. Configuration management, this is a really long time coming, but more specific controls and specific guidelines around how to harden or really lock down computers to very specific standards. That's going to be great. Network segmentation requires separation of EPHI from non-EPHI systems. So a lot of clinics look at this as like maybe a costly step to do, or it's kind of a pain to do it well. And the bad guys really love it when you have a network that's kind of sloppy, and a computer that maybe isn't as secured as tightly is sitting in the same environment as a computer that, you know, the check-in, check-out, and the doctors work from, because it's a really easy hop from an unsecured computer in the same network over to maybe one that you think is more tightly secured. So network segmentation does a lot to slow down the bad guys. It's a great idea. Vulnerability scanning, as proposed, at least every 6 months, and with a more comprehensive, which they do define, pen test done annually. So that's going to be a big one. All right, so that's kind of the high level, and we can go into greater detail. It's not a law yet. Let's address that. So let's talk about, and let's back up just a split second and say, okay, that's where HIPAA is probably going. That's the signs that we're getting, right? That's the leading indicator that this is probably the direction HIPAA is going to go as soon as our lawmakers put it into place. So what happens, just for now, what happens if the NPRM never gets implemented? Where are we at right this second? And I think it's important to step back and put a little bit more detail on this timeline, and to think through, okay, what have we missed? What is currently in place in the HIPAA law and in that ecosystem, and what are the OCR auditors looking at, and what standards are we really being held to as a covered entity? Let's dig in. 96, HIPAA law was put into place. 2009, HITECH was put into place. 2024, yes, the NPRM was put into place, but let's say it never really gets drawn into law. Another thing that happened in 2024 is revision 2 of the National Institute of Standards and Technologies, or NIST for short, 862 document. Revision 2 got put into effect. It was drafted and authorized and published and fully enacted in 2024. Also the National Institute of Standards and Technology drafted and published NIST 853 version 5.2.0. So that was in 2025. So those two happened, and you're like, why do I care? Well, okay, just a little detail. Back in 2005, both of those guys had their draft one. So it's been around for a long time. They're getting, like most of these things, a lot more teeth as they get more specific and more refined, and as the OCR auditors and the rest of the HIPAA laws are saying, go look at these. Let's dig in. All right, what has already been updated? Let's dig into this. NIST 866, and we're going to hit 53, all right? What is it? Why do you care? NIST 866 revision 2 is, for all intents and purposes, gang, is the official playbook for translating HIPAA into like how a cybersecurity program should run. It is very clearly mapped. It is incredibly simple to walk through and say, now it's a long document. Again, I think it's another 120-page all-night read. Takes a lot of Red Bull or coffee or whatever your thing is to get through it. But it's a long read, and it is a very clear, here's how HIPAA says to do it, here's how it should be implemented. It's the closest thing we've got to an implementation guide. All right. NIST 853 is the relevant, like it's the catalog of the specific controls. Now, 853 is not HIPAA specific. It also deals with CMMC and a lot of other government kind of controlled cybersecurity frameworks. And before we go too far off of it, the National Institute of Standards and Technologies are the group that drafted almost every bit of the security controls in the actual HIPAA law. Okay, so they're the federal government. It is the same group of guys who, again, wrote most of the HIPAA law that we kind of deal with in the IT world. So they're incredibly relevant group of guys. They have some of the best and brightest, and gals as well, and just minds. But they have an incredibly deep roster of really deep thinkers about the subjects, and where NIST 853 works is for any organization of any industry. If you're looking at like, how should we do this particular security control, NIST 853 has a really good library of guidance on it, and it's kind of an index to deeper and other documents that specifically address more and more detailed things. What I love about 853 is it really details what security outcomes should look like. Like when we say we want to do MFA, what is the end result of doing MFA well look like, is something that NIST 853 can kind of help you walk through. All right, so digging into those just a tiny bit deeper, let's walk back just a step and say, okay, well, why do we care about each one, and what does each one tell us? So, and this won't take long. Hang with me. 866 revision 2. I'm going to give you just a crash course, the Reader's Digest version, the highlights, all right? Risk analysis is the foundation, and it goes through in painful detail. It starts at risk analysis. And again, remember, this is, the OCR has said this is the guide to use to implement HIPAA, and and we'll get into it in a little bit. When the OCR is doing audits, they're specifically citing NIST 866 and NIST 853. So in their complaints against an organization. So that's why you care, or why you should. So 866 is the foundation. Foundational concept there is that we start with a risk assessment, and it makes painfully clear that if you don't have a well done risk assessment, you have, in no uncertain terms, an undefensible HIPAA compliance program. It really stresses that HIPAA is about risk management, not about perfection. It really talks about the management program that you got to put in for your risks is a process. It's not an annual exercise. So you don't do an annual risk assessment. You put in, maybe you do that, but you don't just stop there. You have to have an ongoing, recurring process. Administrative safeguards matter more than most people think. It really kind of pounds a lot of the policies and procedures and how effective they are and why they care about them, and why they're relevant. Technical controls should follow more modern cybersecurity practices. Remember, NIST 866 Rev 2 is a lot newer than high tech and original HIPAA. So it starts leading the way into what are current acceptable practices for cybersecurity, which again is what OCR is going to look at. OCR is not going to say, are you doing things right according to 1996 technology? They're going to say, are you doing things right according to the last published guidelines that we've put out there for people, which is just a few years ago, 2024. All right, so kind of wrapping up what you should take away from 866, unless you want to read it, is the HIPAA and the NIST cybersecurity framework, or everybody calls it CSF, are really highly aligned with all of 866, and it really pounds that out in a bunch of places. It maps this to that and makes sure that it's very clear how they connect. Specifically, NIST 853, 866 talks about it, and 830, which is a NIST guideline on specifically like the very detailed, here's how to do a risk assessment, and other NIST guidelines. There's a bunch, but 866 kind of highlights a few of them. 53 and 30 being the cybersecurity framework being the top ones. All right. So high level, 866 is important to us. Last version of it was from 2024. It is pounding the idea of we got to do a risk assessment. And they specifically reference a secondary document that says, here's how to do a risk assessment. Don't come up with your own way. We want you to do it our way. All right. Next up, 853. Why do we care about it? It's the federal government's like master list of here's how things should be done in the world of cybersecurity. It may not be the detailed everything, but it's kind of a great index. So there's some things that it says, go look at this other document to dig a little deeper on this, but it's kind of a catalog of when we talk about X, Y, and Z technologies or controls or safeguards. It talks about kind of that, again, that outcome of what it should look like. And it is candidly a great source if you want to bring this to your CEOs or your doctors that own the practice or whoever the decision makers are there. It is a no questions asked guideline on here's what we really should be doing if we want to stand a chance and be able to say we have a cybersecurity program that we're doing our best. We're doing reasonable and appropriate. Again, reasonable and appropriate. Reasonable and appropriate are from HIPAA 1 and high tech words. They got kind of used and misused a lot over the years. 853 aims to kind of correct that and say what we mean reasonable and appropriate is this, this, and this. All right. So it's a great guide on how to do things the way they think is the right way. And honestly, it's very good guidance from any industry, healthcare or not. It's really solid advice. All right. Caveat, following all these things, including NIST 853, doesn't guarantee that you're not going to be breached. All right. It's important that you hear me say that. But it, especially NIST 853 and in your documents, if you say we're doing this according to the NIST 853 revision 5.2 or be real specific. If you say you're doing that and you can prove it, it's a great demonstration that you took reasonable and appropriate measures. All right. That's what it does for you. Is it helps kind of clarify your position and gives you room to defend yourself. All right. Let's get into here's what to take away and what to do. I read all of 853, all of 866, and all of the administrative simplification, probably word for word. Might have been a year or two on a few of them. This is my interpretation of like the top 6 things that if I were to say like do these today, the most important things you could do, and there's a lot of room to support this from other from the NIST guidelines as well. It isn't all Henry's idea. I really did steal it 100% from NIST. But you want to get Henry's top 6, not top 10, sorry, things to do to reduce your pain and headaches in your practice and get ready to crush that OCR audit and avoid cyber attacks. Let's do it. Let's walk through this. Let's see. Top 6 things. All right. Number six, have a vulnerability management program, monthly vulnerability scanning, and critical vulnerability tracking is so important. That is the number one way that hackers are getting in right now, by the way, is by a lot of industry reports, is exploiting vulnerabilities. There's a whole longer conversation about that, about how AI is helping them find vulnerabilities faster than they have ever in the history of computers. But short version, this is really important. And patch management. If it's running, if you use it, if it's out there, if it's hardware, software, application, operating system, firmware, I don't care what it is, if it can be patched, you really should have a process by which you think about patching it, apply the patches fast, especially for critical patches, those kind of things. All right. Number 5, implement comprehensive logging. Microsoft 365 If you don't have logging on your Microsoft 365, you are wildly hanging out there and not safe. Like security event monitoring, is an incredibly important thing. All of these, by the way, we can pull from NIST 853. And all of these are going to be required when the NPRM goes into place, if it happens the way it's currently drafted. Number 4, encrypt PHI anywhere, everywhere possible, everywhere remotely possible. All right. BitLocker on your workstations is a great tool. It's a good start. It's a little clunky in how you manage it. You can talk to our technicians about like that. But there's tools that make BitLocker better and make it to where you can brick a computer if it's stolen or lost quicker, and have a lot better controls around it. Or you can spend a lot of time and expertise mastering just the Microsoft tools. But short version, BitLocker, or some kind of encryption everywhere humanly possible on your data where it's sitting at rest on those computers, and lean towards thinking what the NPRM has predicted as the definition of a relevant system. It's anywhere that if a bad guy was sitting at it, they could possibly access and breach data. So those home computers, the remote computers, the computers that you don't want to talk about because, that's the doctors or whatever the situation is, we need to talk about it. TLS email encryption, transport layer security, or just some kind of email encryption. Make it policy based so it happens automatically. You have no idea how many times your staff is accidentally or intentionally sending out PHI unencrypted. And if you have a system that catches that and encrypts it automatically, it will save your bacon. I promise. We've seen it more times than I can count on at least 10 fingers and 10 toes. Why you care from an operations perspective. Vulnerability management is going to reduce the likelihood of a breach. Implement comprehensive logging is going to reduce the downtime in the event of an issue. Encrypting the PHI is really going to help you reduce the likelihood of a breach. All right. Let's move on to number 3. Require MFA everywhere possible, like Microsoft 365, VPN, remote desktop, administrative accounts. If you think it's turned on, go check. Please go check. Review that and look for, especially like in Microsoft 365, there's 3 things that you can look for on a list of user accounts. There's a screen that shows MFA status. It can say disabled, required, or enabled. What you really want to look for is required. All right, because that means that the user can't accidentally go turn it off, or a bad guy gets a hold of the account, can't go turn it off for them. All right. Many healthcare breaches involve stolen credentials. Stolen credentials is the number 2 way bad guys are getting in. All right, has been for years. Some years it's number 1. Right now it looks like it's the number 2 way. Past exploiting vulnerabilities is really important. Staffing benefit. We talked about kind of staffing is a real pain for a lot of clinics. Done well, some of the newer single sign-on and MFA kind of integrations, like there's a new technology with Microsoft 365 called Windows Hello. You combine that with MFA and user sign-on. I'm not going to say it's like a joy and it's something I look forward to, but it's like literally I sit down at my computer and I click one button and I'm in, and I'm incredibly secure. So it can actually reduce the pain of login, make it really secure, and really make this a thing that your staff does not fuss at you about anymore, right? Financial benefit, MFA is going to reduce your cybersecurity insurance. And if you can prove that you're really honestly doing it, you'll have a much better chance of the insurance company coming through for you in the event of a claim. All right. All right, let's move on to number 2. Implement strong access controls. Not going to beat this one up really hard, gang, but unique user IDs. If I could say it again, unique user IDs. Maybe unique user IDs would be important. role-based access, least privilege, have a really strong termination process that includes your IT department. Speaking from an IT company, please let us know when you let go of somebody, or please let us know a few days ahead when you're going to bring on somebody, and if as much as possible, as soon as possible, when you're going to let go of somebody, because there's a lot of IT stuff that we got to turn down. And all you IT people on the call are like, yes, thank you. So unique user IDs might be a good idea on this one too. And just the idea, like, it would be a really good idea to audit your systems and see how many people that you fired a long time ago or resigned or whatever are still in your systems. They still have accounts. Staffing benefit, like done well, again, reducing password, it reduces password sharing to do this well, and it simplifies your onboarding and offboarding process and reduces like oh shoot, we hired so and so and she doesn't have accounts, or oh shoot, we let go of so and so 2 years ago and she's still got an account. So number one, let's hit the number one: perform a risk assessment. Do it well, and document it very well. Without beating this up really hard, an enterprise wide risk assessment using the NIST 800-30 guidelines, and certainly going up to its parent document 853. But they are very clear about here's how we want it done. Most covered entities do not do this well. I'll be honest with you. It is shocking. It is true, and I understand why the OCR is making this a big deal. All right. So when OCR comes in right now, they're really, again, from 2024, they've got this initiative where they're looking for risk analysis is being done well. And they're finding that they're not updated recently, they're incomplete, or they just don't exist, period. All right. So and there is a specific guideline for how to do it. So financial benefit, just done well, you can eliminate the OCR fine. If you have an issue, they come in and audit you. We don't want to add pain on top of pain by them saying we're going to fine you for having the issue that caused the breach, and we're also going to fine you for having not done a risk assessment. That would be terrible and simply avoidable. Reduce the likelihood and impact of a breach or a disaster. Really, you do a good risk analysis and it guides your executive team on here's the things we should do to shore the organization up. It is an incredibly powerful tool, and one that is incredibly cheap. Even if it costs a little bit to do it, it's incredibly cheap compared to a breach. All right. And operations benefit helps reduce downtime after an incident. If you got a plan because you did the risk analysis and you say, like, this is probably a risk, here's our steps, how we're going to mitigate it, then you've got a plan and you're going to be able to respond quicker. All right. So that's your top 6. If you want a deeper guide on that, and we're not done here, I got just a few more seconds to walk through some things. But if you want a guide on like a longer set, because there's more than 6, but those are just my top 6. We've got a guide that we've prepared and we walk through with a lot of our clients on like basically NIST for HIPAA. All right. So just email us at ask@turnkeysolve.com. Mention this webinar. We'll send it right over to you. All right. All right, so let's back up just a second and say, okay, the section of the webinar we're in is what's already been updated. All right, what's changed with HIPAA? We know just recently 866 had an update, and 853 had a significant update in 2025. And we've talked about it a few times, just kind of quickly. In 2024, October of 2024, the OCR formally announced what they call the Risk Analysis Initiative. All right. So this is a big sign. All right. This is a huge leading indicator that you got to pay attention to. You got to make sure that the decision makers at your practice are aware of. This has to be on your radar. What is this OCR Risk Analysis Initiative? It aims to highlight the failure to perform and maintain an accurate, thorough, documented risk analysis of your EPHI. All right. It is a huge focus. When they come in and find a breach, this is not going to be something that's an ancillary or supporting detail. It is going to be one of the top two things that they're going to talk about. Did you do the risk assessment? And then what happened with the incident? OCR has elevated this again from a routine finding to a dedicated initiative. To date, since October of 2024, they've produced 14 enforcement actions, i.e. settlements. And just kind of a quick idea of some of them. Bryan County, $90,000, no prior risk assessment, little tiny group. Comstar LLC, they're a business associate, 75 grand for not having done a accurate and thorough. July 25, a behavioral health group, $250,000 almost, for having not done a risk analysis and then thus failed to identify vulnerabilities. Here's your sign. Again, as you know, when we see Jim Cantori, we know there's a hurricane coming. When you see these things coming, you know you ought to do a risk analysis and learn how to do that well. A couple more. July, just like we're talking days ago, literally just days ago, a over $500,000 settlement for having failed to conduct an accurate and thorough analysis. June, $375,000 for assured imaging, failure to conduct. April 23rd, $320,000 settlement. All right, so enough of that. Like, this is happening, gang. Please pay attention. It would be terrible to have this happen to you afterwards and having that done. So, like, what do I do? Let's wrap up. What do we do next? If I had to say do something, go look at old school HIPAA, 45 CFR 164 308, the risk analysis. It is required, and people do that poorly, which a lot of those fines we're having for not having done it properly. So how do we do it? Look at NIST 800-30 and NIST 853. Look at those two specific documents. And if you want to bubble up a little higher, 866, we talked about it. But 830 is the guide for conducting risk assessments. If you just did that, if you just went into 800-30 and followed it word for word, you would have done an amazing risk assessment. Okay. All right, so let's wrap up. What are we proposing you do? Look, there's a lot of groups out there that say we've done a risk assessment, we've done a risk analysis, we think it was done according to NIST 830. How do we understand it? You don't have to say we're going to bite off all 120 pages of 800-30. If you want to plan for how to kind of get started, I would recommend and kind of prepare for like what's in the future. What we do for our clients is we can help you with a readiness assessment, okay? And what that kind of looks like is we do some Q&A with your team. We do a little bit of a technical assessment to get a feel for the inventory, and we start to understand your systems and what you have out there. We have our technicians and our lead engineers and our lead compliance groups look at that. Then we look at your risk assessment. Like, let's see your last copy of your risk assessment and look at it. Just send it over. We'll walk through it. By the way, we'll sign a BA before we ever start with step 0. We're going to build a plan for you and help you see, okay, based on what we understand, NIST and HIPAA and OCR say you got to do, here's the next steps. And we're going to always try to make that really simple and kind of C-level so that you can take it to the decision makers. So how that works, it's not painful. We do this for smaller groups, like 1 to 40 staff. It's $899 process. If you want to look at doing this soon, by all means, scan this QR code or go to turnkeysaw.com/HIPAA ready. turnkeysaw.com/HIPAA ready, or scan the QR code. and we will get you signed up. We'll ask you a few questions, and we'll see when it's time to start. And I can do 5 of those at 0 cost if you will sign up before August 28th. It is kind of a limited time. I've got a little bit of staff availability that we can queue this in. All right. So that's the short version. And again, if you want to email us, ask@turnkeysol.com, we will be more than glad to share with you that checklist for NIST and HIPAA and how, the specific steps that we think every covered entity ought to walk through. And high level, that is it. I really appreciate you joining us.